On their classification. The first class of drug is 5-HT3 or serotonin receptor antagonist. One example is ondansetron. Second class of drugs is corticosteroids. One example is dexamethasone. The third class of drugs is NK1 receptor antagonist. Example is aprepitant. So these drugs end with the word pitant. The fourth class of drug is antipsychotics. In that there could be phenothiazines, for example chlorpromazine, chlorperazine. There can be butyrophenones, such as haloperidol, droperidol, and there could be drugs like olanzapine. Which is an atypical antipsychotic. Then after antipsychotics, there can be drugs like substituted benzamides, example could be metoclopramide, and trimethobenzamide. Sixth class of drugs is anticholinergics. That example is hyoscine, which is also known as scopolamine. Seventh class of drugs is H1 antihistaminics. For example, diphenhydramine, dimenhydrinate, etc. Eighth class of drug is benzodiazepines. For example, lorazepam, diazepam. Ninth class of drugs is cannabinoids. That the drugs are dronabinol, and nabilon. Now let's discuss first 5-HT3 receptor antagonist. Or serotonin antagonist. So the mechanism of action is, first there is a central action which is through blockade of 5-HT3 receptors in vomiting centers and chemoreceptor trigger zone. So there is blockade of 5-HT3 receptors in vomiting center and chemoreceptor trigger zone, but this is only a minor action. The major action of 5-HT3 receptors is 5-HT3 receptor antagonist is peripheral, where it acts on GIT, the vagal and spinal afferents in GIT, and blocks 5-HT3 receptors over there. Vagal and spinal afferents from GIT, they have 5-HT3 receptors which are blocked, and then GI irritation does not cause vomiting. Now what are the drugs? The drugs are ondansetron, granisetron, dolasetron, palonosetron, now all these drugs are available as oral as well as IV formulations. These are available oral also as well as IV also. However, this granisetron, so all are available orally and IV. This granisetron is available as a transdermal patch. Now these three, ondansetron, granisetron and dolasetron, these are known as first generation 5-HT3 receptor antagonist, and they have a half-life of 4 to 9 hours. While this palonosetron is second generation antihistaminic. And it has a second generation anti-5-HT3 receptor drugs, not antihistaminic, sorry. So it is a second generation 5-HT3 receptor antagonist, and its half-life is around 40 hours, so it is long acting. This palonosetron, P for you can remember, is the most potent and longest acting 5-HT3 receptor antagonist. Palonosetron is most potent and longest acting 5-HT3 receptor antagonist. Now all these 5-HT3 receptor antagonists are metabolized by liver and kidney. So they have hepatic and renal route of metabolism. But dose reduction is not required in geriatric and in kidney disease. However, there is one exception. In liver disease, ondansetron requires dose reduction. Now, what are the side effects? First, uses. What are the uses of these drugs? They are the drug of choice for chemotherapy induced nausea and vomiting. That is CINV. So these 5-HT3 receptor antagonists which end with the word cetron are drug of choice for chemotherapy induced nausea and vomiting, especially early type of chemotherapy induced nausea and vomiting. Early means less than 24 hours of onset of chemotherapy. And they are given usually 30 to 60 minutes before the start of chemotherapy. They are not that effective in delayed type of nausea and vomiting, chemotherapy induced nausea and vomiting. Not effective in delayed type of CINV. The only exception is palanositron, which is most efficacious for early type. What is the exception here? Palanositron. It is most efficacious for early nausea and vomiting, early chemotherapy induced nausea and vomiting, and also has efficacy in delayed chemotherapy induced nausea and vomiting. Now they are usually given as a combination therapy also. What combination therapy? 5-HT3 receptor antagonist, corticosteroid, and NK1 antagonist. These NK1 antagonists we will discuss later. So these three are used as a combination in chemotherapy induced nausea and vomiting. Now you have to remember that this NK1 antagonist is the drug of choice for delayed CINV. This NK1 antagonist is the drug of choice for delayed CINV, delayed chemotherapy induced nausea and vomiting. Now 5-HT3 antagonists are also drug of choice for radiation induced nausea and vomiting. Especially vomiting is more common after GIT irradiation or whole body irradiation. So radiation induced nausea and vomiting, 5-HT3 receptor antagonists are drug of choice.